Hello friends, I'm Dr. Everly. Today we're going to talk about an enemy that might be silently accumulating inside your heart right now, slowly wearing down your arteries, and leading you to death without you even noticing. Its name, hypertension. Or as we commonly know it, high blood pressure. But wait, this isn't just an elderly person's problem. Perhaps even you, sitting in front of the screen right now, might have this silent killer at work in your veins. And the scariest part? You probably don't even know it. Because every year worldwide, 10.7 million people lose their lives due to complications caused by hypertension. Yes, you heard that right, 10.7 million people. This number means that every 3 seconds, someone dies because of hypertension. So what about your blood pressure? When was the last time you checked it? If your answer is I don't remember, then I can tell you this video is exactly for you. Because today I'm going to explain everything from what hypertension is, what it does to your body, to how it's treated. And I guarantee, after watching this video, you'll never take your blood pressure lightly again. Are you ready? Then let's begin. What is hypertension and why is it so common? Friends, first let me say this, hypertension is literally in pandemic status. 1.3 billion people worldwide are living with this disease. In Turkey, 1 in every 3 adults is a hypertension patient. And the scary part is, more than half of these patients aren't even aware of their condition. So what is this hypertension? Simply put, it's when your blood pressure consistently runs higher than normal levels. In medical definition, values of 140/90 mmHg and above are considered hypertension. However, since 2017 in America, this limit was lowered to 130/80, and look, with this change, suddenly 45% of Americans fell into the hypertensive patient category. Now up to here it's all well and good, but you might ask what these numbers mean. Let me give you an analogy. Imagine your arteries are a garden hose. Now if water flows through this hose at normal pressure, the hose will remain intact for many years. But what happens if you increase the pressure too much? The hose gradually begins to wear out, crack, even burst. Your body's blood vessels are exactly the same. High blood pressure constantly applies excessive pressure to your artery walls, and this situation leads to serious damage over the years. And look, this isn't just theoretical information. In the 30 years from 1990 to 2019, the number of people with hypertension doubled from 650 million to 1.3 billion. So this disease is becoming increasingly widespread. But why? There are many reasons for this, of course. First, our modern lifestyle, excessive salt consumption, inactivity, obesity, stress, alcohol use, smoking. All are hypertension's closest friends. Especially salt. While the World Health Organization recommends maximum 5 grams of salt per day, most of us consume twice that. And the funny thing is, we often don't even realize it because salt is already in processed foods, canned goods, and fast food. What's happening in your body? The mechanism of blood pressure increase. Now let's look at what's really happening in your body. Because blood pressure increase isn't a random event, there's complex physiology behind it. Your heart pumps blood into your vessels with each beat. This blood applies pressure to vessel walls, and that's what we call blood pressure. There are 2 numbers, systolic, the top number, and diastolic, the bottom number. Systolic shows the pressure when the heart contracts, while diastolic shows the pressure when the heart relaxes. Now, there are several important systems in your body that regulate blood pressure. The most important of these is the renin-angiotensin-aldosterone system. This system starts in your kidneys. When the kidneys detect that blood pressure is low, they secrete an enzyme called renin. This enzyme leads to a series of chemical reactions and eventually forms a powerful vasoconstrictor, vessel narrower, substance called angiotensin II. Angiotensin II does these things. It narrows vessels, signals the kidneys to hold on to salt and water, sends orders to the heart to pump more strongly. All of these are necessary to raise blood pressure under normal conditions. But what if this system becomes overactive? That's when chronic hypertension begins. There's also the sympathetic nervous system. When you're stressed, when you're scared, your heart rate speeds up, right? That's the system's job. But if you're constantly under stress, this system stays constantly active and your blood pressure runs constantly high. And of course, the amount of sodium in your body is very important. When you eat too much salt, your body holds on to more water to dilute this salt. More water means more blood volume. More blood volume means higher pressure. Simple math. The symptoms of the silent killer, or mostly the lack thereof. Friends, do you know why hypertension is called the silent killer? Because most of the time it gives no signs. Yes, you heard that right. Your blood pressure could be 160/100 and you might not feel it. You're continuing with your normal life, going to work, exercising. And one day you suddenly have a heart attack. That's why it's dangerous. But in some cases there can be symptoms. Especially when blood pressure runs very high at critical values like 180/120 and above, some symptoms can appear. Headache, especially a heavy headache in the mornings. And this headache is felt in the back of your head, near the neck. Like a pulse beating inside your head. Dizziness, blackouts when you stand up, feeling of losing balance. Blurred vision, blurry images in front of your eyes, light flashes. This is a very serious symptom because it can show that your retinal vessels are damaged. Shortness of breath, unable to breathe while climbing stairs, walking. The heart trying to cope with the pressure can create shortness of breath. Chest pain, this is definitely a symptom that should be taken into account. Tightness, heaviness in your chest. Ear ringing, a constant buzzing, ringing sound. Heart palpitations, feeling your heartbeats, irregular heart rhythm. But I also need to add this, even if these symptoms exist, most people interpret them as fatigue, stress, or natural consequences of aging and dismiss them. That's the biggest mistake. If you have these symptoms, you absolutely must have your blood pressure measured. And by the way, there's also something we call hypertensive crisis. When blood pressure rises above 180/120, emergency intervention is needed. In this situation, symptoms like nausea, vomiting, severe headache, vision loss, confusion appear. If you're experiencing these symptoms, please go to the emergency room immediately. Because this situation can lead to life-threatening conditions like stroke, heart attack, kidney failure. Complications of hypertension, the real danger is here. Now let's get to the most serious part. Why is hypertension so dangerous? Because it silently damages everywhere in your body. Heart diseases, high blood pressure forces your heart to work excessively. Your heart muscle thickens, left ventricular hypertrophy, which can lead to heart failure. Also, narrowing occurs in your coronary arteries and grounds are prepared for heart attack. Nearly half of cardiovascular deaths worldwide stem from hypertension. Stroke, blockage or bleeding can occur in vessels going to your brain. Statistics show that someone with hypertension carries 4 to 6 times more stroke risk than someone with normal blood pressure. And stroke can leave you paralyzed, make you lose your speech ability, even kill you. Kidney damage, your kidneys filter blood, clean waste. But high pressure damages kidney vessels. Over time, kidney function decreases and chronic kidney disease develops. Statistics are frightening. Hypertension is the second most common cause of end-stage kidney failure. And when kidney failure develops, you either get dialysis for life or wait for a kidney transplant. Eye damage, vascular damage occurs in the retina, retinopathy, can lead to vision loss. In severe hypertension, damage can even be seen in the optic nerve. Sexual problems, erectile problems in men, decreased libido in women. Because blood flow to the genital area decreases. Metabolic syndrome, hypertension usually doesn't come alone. It brings obesity, high blood sugar, high cholesterol with it. When all together, we call it metabolic syndrome, and this situation is like a bomb for cardiovascular risk. And look, the development of these complications can take years. You might have slightly high blood pressure in your 30s and not feel anything. But by your 50s you could have a heart attack. That's why early diagnosis and treatment are so important. History, the discovery of blood pressure and hypertension's place in medicine. Friends, now I'm going to give you a little history lesson. Because the discovery of blood pressure is truly one of the most important turning points in medical history. First, in 1733, an English clergyman named Stephen Hales made the first blood pressure measurement on a horse. But pay attention, to do this he inserted a 3.5-meter long glass tube into a vein in the horse. He measured the pressure by looking at how high the blood rose in the tube. Frankly, this method wasn't very practical for humans. In 1881, Samuel Siegfried Karl Ritter von Basch invented the first sphygmomanometer, blood pressure measurement device. But the real breakthrough discovery was made in 1896 by Italian doctor Scipione Rivaracci. He developed his mercury manometer device, which was the precursor to the modern blood pressure device. An inflatable cuff, mercury column, and a stethoscope. That's how one of the foundations of modern medicine was laid. But a more important development occurred in 1905. Russian surgeon Nikolai Korotkov managed to distinguish systolic and diastolic pressure by listening to arterial sounds with a stethoscope. This is still the method we use today. These sounds, known as Korotkov sounds, show different phases of blood flow. So what about the recognition of hypertension as a disease? For this, we had to wait until the mid-20th century. In the 1930s, famous names like President Franklin D. Roosevelt died from hypertension. Roosevelt's blood pressure had risen to 300/190 and it killed him. At that time, there weren't many treatments for hypertension. For some, there was even a distinction between good hypertension and bad hypertension. Some doctors even said we shouldn't intervene in hypertension, this is a compensatory mechanism of the body. What a wrong view, right? By the 1950s, diuretics were discovered. The first was chlorothiazide, and this drug truly revolutionized things. Then in the 1960s came beta blockers. These were developed by British Dr. James Black and he received the Nobel Prize for this discovery. Then calcium channel blockers, ACE inhibitors, ARBs, and today we have a powerful arsenal of drugs. Celebrities and hypertension, they're human too after all. Friends, sometimes we forget that famous people have problems just like us. But hypertension doesn't distinguish between rich-poor, famous-ordinary. Let's look at a few examples. Franklin D. Roosevelt, America's 32nd president, died from a massive stroke in 1945. His blood pressure had risen to 300/190 but effective treatments didn't exist at that time. Michael Clark Duncan, known for his magnificent acting in the Green Mile film, had hypertension and kidney problems. He had a heart attack in 2012 and passed away. Toni Braxton, the famous singer, was diagnosed with high blood pressure in 2004. She also had pericarditis, inflammation of the heart lining. Fortunately, she controlled her condition with medications and an active lifestyle. Oprah Winfrey, even the world's most famous talk show host, is fighting hypertension. She manages her condition with weight loss and lifestyle changes. Tina Turner, the queen of rock and roll, was diagnosed with uncontrolled hypertension in 1978 but didn't take it too seriously. Years later, she developed kidney failure and had to have a kidney transplant. She passed away in 2023. Billy Mays, TV advertiser, died from hypertensive heart disease in 2009. Complications of untreated chronic high blood pressure. You see, being famous, being rich, being successful doesn't protect you from hypertension. But early diagnosis and proper treatment save lives. Blood pressure measurement, how and when? Friends, now I'm coming to a very practical topic. How to measure your blood pressure and when you should measure it. First, know this, according to the World Health Organization, only 54% of hypertensive patients are aware of their disease. Only 42% receive treatment. And only 21% have their blood pressure under control. These numbers are terrible. Because this means you can suffer silent damage for years because you don't know about the disease. How to measure at home. If you have hypertension or are at risk, you should keep a blood pressure device at home. Digital ones are very practical and reliable. Here are tips for correct measurement. Don't consume caffeine, cigarettes, or exercise 30 minutes before measurement. Sit in a comfortable environment, in a quiet place. Your feet should be flat on the ground, don't cross your legs. Your arms should be at heart level. Measure after resting for 5 minutes. Take 2 measurements, 1 to 2 minutes apart. Make morning and evening measurements, for at least a week. Normal values, below 120/80 mmHg. High normal, 120/129/80 mmHg. Stage 1 hypertension, 130/139/80-89 mmHg. Stage 2 hypertension, 140/90 mmHg and above. When to see a doctor? If your blood pressure is above 140/90. If there's sudden chest pain, shortness of breath. If there's severe headache, blurred vision. If your blood pressure is 180/120 and above, emergency. Natural treatment methods, drug-free solutions. Now we've come to the most important part. Because friends, lifestyle changes are so effective in treating hypertension that some people may not even need to use medication. Diet against hypertension. The dietary approaches to stop hypertension diet was developed by Johns Hopkins researcher Lawrence Appel and showed incredible results. Research shows that systolic blood pressure drops 8 to 14 millimeters of mercury in people applying the diet. This is as much as some medications effect. Basic principles of the diet. Plenty of fruits and vegetables, 4 to 5 servings of vegetables, 4 to 5 servings of fruit per day. This provides you with potassium, magnesium, calcium, minerals that lower blood pressure. Whole grains, whole wheat, brown bread, brown rice, quinoa, oats instead of white bread, white rice. Lean protein, chicken, fish, legumes. Especially omega-3 rich fish, salmon, mackerel, sardines, are great. Low-fat dairy products, milk, yogurt, cheese, but not full-fat. Limited salt, 1,500 to 2,300 milligrams sodium per day. This means about 1 teaspoon of salt. And remember, most salt is hidden in processed foods. Limited red meat, maximum 2 to 3 servings per week. Red meat has too much saturated fat and this raises blood pressure. Avoid sugar, sodas, sweet tea, fruit juices. All cause weight gain and blood pressure increase. In a scientific study, people who applied the diet for just 2 weeks showed marked decrease in blood pressure. Isn't that incredible? Salt reduction, big effect. Friends, the salt issue is really very important. When your body gets too much salt, it holds water to dilute it. More fluid equals more blood volume equals higher pressure. Simple. Average salt consumption in Turkey is around 15 to 18 grams per day. This is 3 times the recommended amount. So how will we reduce it? Don't use a salt shaker at the table. Stay away from processed foods like canned goods, pickles, sausages, salami. Read labels. More than 1.5 grams of salt per 100 grams is considered high. Add flavor with spices, thyme, mint, basil, lemon juice. Choose fresh, natural foods. The sodium study showed that blood pressure dropped even more in people who reduced salt intake to 1,500 milligrams per day. Exercise, natural medicine. Regular exercise can lower blood pressure by 5 to 8 millimeters of mercury. How? Exercise keeps your vessels flexible, strengthens the heart, controls weight, reduces stress. What to do? 150 minutes of moderate intensity exercise per week, brisk walking, cycling, swimming. Or 75 minutes of vigorous exercise per week, running, aerobics. 2 days of strength training per week. Get moving every day, climb stairs, go for walks, do garden work. And remember, don't start with sudden, strenuous exercises. Increase gradually. Especially if you have uncontrolled hypertension, consult your doctor before starting exercise. Weight loss. Losing each 1 kilogram of excess weight lowers your blood pressure by about 1 millimeter of mercury. So when you lose 10 kilograms, your blood pressure can drop 10 millimeters of mercury. This is an incredible effect. Stress management. Chronic stress keeps your blood pressure constantly high. What can you do? Meditation, deep breathing exercises. Yoga. Acquire hobbies. Strengthen your social relationships. Sleep adequately, 7 to 8 hours. Don't forget to laugh, I'm serious, laughing lowers your cortisol level. Alcohol and smoking. Alcohol, maximum 2 drinks per day for men, 1 drink for women. More raises blood pressure. Smoking, definitely quit. Every time you smoke, your blood pressure rises for 20 minutes. It also seriously damages your artery walls. Natural supports. Some foods and supplements can help lower blood pressure. Garlic increases nitric oxide production, dilates vessels. Beet juice contains natural nitrates. Hibiscus tea, mild diuretic effect. Omega-3 fatty acids, fish oil capsules. Coenzyme Q10, antioxidant effect. Magnesium helps vessel relaxation. But beware. These don't replace medication. They're only supportive. Drug treatment, what you need to know. Friends, when lifestyle changes aren't enough, drug treatment is necessary. And here's good news, today we have very effective drugs to control hypertension. Diuretics, water pills. Helps you excrete excess salt and water from the body. One of the first choice drugs. Like hydrochlorothiazide, chlorthalidone. Cheap, effective, safe. Side effects, frequent urination, potassium loss, so eat bananas. ACE inhibitors, angiotensin-converting enzyme inhibitors. Those with pril in the name, enalapril, lisinopril, ramipril. They prevent angiotensin II formation, relax vessels. Very effective. Side effect, dry cough, in 10%. If cough is very bothersome, switch to ARBs. ARBs, angiotensin receptor blockers. Those with sartan in the name, losartan, valsartan, irbesartan. Similar effect to ACE inhibitors but doesn't cause cough. Few side effects. Beta blockers. Those with olol in the name, metoprolol, bisoprolol, atenolol. Slows heart rate, lightens the heart's work. Especially preferred if there's heart failure, arrhythmia, coronary artery disease. Side effect, fatigue, cold hands feet. Calcium channel blockers. Amlodipine, nifedipine, diltiazem. Relaxes vessel muscles. Side effect, ankle swelling. In most patients, one drug isn't enough, combination is needed. For example, ACE inhibitor plus diuretic is a very effective combination. Or ARB plus calcium channel blocker. And remember, use medications regularly. Even if your blood pressure returns to normal, don't stop the medication yourself. Because drugs don't solve the problem, they keep it under control. Things not to do in hypertension. Friends, now let me tell you what you shouldn't do. Because some mistakes can worsen the situation. 1. Using medications irregularly or stopping them on your own, this is the biggest mistake. Use your medications on time, regularly. 2. Continuing to consume salty foods, chips, salted nuts, canned goods, salami, sausages, pickles. Stay away from all of them. 3. Remaining obese, excess weight constantly creates burden. 4. Sedentary life, sitting for hours in front of the TV, driving cars, elevators. These make your body lazy. 5. Smoking and excessive alcohol, direct damage to your vessels. 6. Unable to manage stress, being constantly tense keeps your blood pressure constantly high. 7. Not getting regular checkups, go for checkups at least 2 to 3 times a year. 8. Measuring blood pressure only at the hospital, measure regularly at home too. There's something called white coat hypertension, your blood pressure rises only when you go to the doctor. 9. Trusting herbal products too much, garlic, linden are nice and all but don't replace medications. 10. Ignoring symptoms, headache, dizziness, blurred vision. Don't accept these as normal. Things to do in hypertension. 1. Regular checkups, check your blood pressure, kidney functions, cholesterol at least twice a year. 2. Blood tests, creatinine, urea, electrolytes, sodium, potassium, lipid profile, LDL, HDL, triglyceride, blood sugar. These show hypertension's effects on kidneys and metabolism. 3. Eat healthy, apply diet principles. 4. Exercise regularly, 150 minutes per week. 5. Maintain your ideal weight. Your body mass index, BMI, should be between 18.5 to 24.9. 6. Manage your stress, meditation, yoga, hobbies. 7. Use your medications regularly. If you forget, set alarms, use reminders. 8. Reduce salt, less than 5 grams per day. 9. Quit smoking, limit alcohol, this is absolutely necessary. 10. Sleep adequately, 7 to 8 hours of quality sleep. 11. Keep a blood pressure device at home, make regular measurements, keep records. 12. Inform your family, teach them what to do in emergencies. Effects on blood values. Hypertension doesn't just affect blood pressure, it can disrupt your other blood values too. Kidney functions, creatinine and urea rise. Glomerular filtration rate, GFR, decreases. Normal GFR is above 90, in hypertension this can drop below 60. Electrolytes, potassium imbalances can occur, especially if you're using diuretics. Lipid profile, high LDL, bad cholesterol, low HDL, good cholesterol, and high triglyceride are commonly seen in hypertensive patients. This is part of metabolic syndrome. Blood sugar, hypertension and diabetes are frequently seen together. Fasting blood sugar and HbA1c control is important. Urine test, proteinuria, protein in urine, is an early sign of kidney damage. That's why regular blood tests are very important. Final words and recommendations. Friends, we've come to the end of the video. Now I want to summarize the most important information for you. Hypertension is a disease that affects 1.3 billion people worldwide, causes 10.7 million deaths annually, but is controllable. Yes, controllable. Managing hypertension is possible with lifestyle changes, proper drug treatment, and regular checkups. And you have to do this. My request from you is this: buy a blood pressure device today. Measure your blood pressure tomorrow morning. If it's high, go to your doctor. Take action before it's too late. And remember, knowing your blood pressure can save your life. Because being conscious is the first step of protection. Also remember, reduce salt, exercise, eat healthy, manage stress, quit smoking. These aren't just empty words, they're scientifically proven, life-saving recommendations. If this video was useful for you, please don't forget to like and subscribe. Because I'm Dr. Everly, as your health's best friend, preparing scientific, entertaining, and educational videos for you every week. Until we meet in the next video, stay healthy. And please, get your blood pressure checked.